Yeah, so that's a really timely question about sequencing right now. We have PATINA data, which is another trial that looked at the maintenance setting. PATINA was only for patients that had a hormone receptor positive disease. So that did not include HR negative patients like our study. But really the magnitude of benefit in PATINA was very impressive. It was about 15 months. When we look at the control arm of PATINA as well as the control arm of our study, it's pretty clear that these were really not the same population of patients. The control arm in PATINA was a PFS of 29 months, improved up to 44 months. Our trial was only 18 months in the control arm. So really the PATINA population represented probably a little bit more of an indolent population. They also had more endocrine therapy usage than we did, so that could have also affected the results. So ultimately, I think it's nice to have options for our patients. The other new data is DB09, not approved yet, but Trastuzumab Deruxtecan in the first-line setting. I think really what's going to happen is that regardless of what you choose to do induction chemotherapy with, whether that's THP, whether that's Trastuzumab Deruxtecan, I think there's going to be a big appetite to use a maintenance strategy, PATINA or HER2 Climb 05, regardless of what people get in the first-line induction.